Hello, everyone. Thank you so much for joining me on this program focused on African women's health. This is a weekly program, and in this program, we emphasize the importance of promotion of African women's health at home and abroad. We share the global message of health for all and emphasize that African women must not be left behind in optimal health. This is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Last week, our focus was on women empowerment, and we emphasized the importance of creating an enabling environment for women to contribute to development or whatever areas that they have chosen for as an area of delight for themselves. This week, we'll be looking at the topic osteoporosis. Osteoporosis. What, in essence, is osteoporosis? It is a bone disease. And we look at the issue of the bone. You will agree with me that the bone is a vital organ in the body, which has high potential to regenerate. However, as people grow older, the bone capacity to regenerate reduces, and this in many times leads to osteoporosis. In essence, for people that are living with osteoporosis, the bone becomes weak, and this presents a high risk of fracture or breaking. Osteoporosis may actually not present with symptoms till the bone fractures. So it is important to pay attention to this important topic area. It has been increasingly evident that there are population differences in bone mass and risk of osteoporosis. There are studies that have reported Africans as having strong bones. For example, there is the incidence of fracture in African American women that is reported to be half of similar incidence among the white women in the United States of America. Given this, there may then be the temptation to ask, why do we then need to bring this topic, osteoporosis, our way on a program like this that focuses on African women's health? There are a number of reasons why I'm bringing this topic your way. The first reason is that of biological reason. In comparison to men, women are at a higher risk of osteoporosis, and they have a lifetime risk of an osteoporosis-related fracture as high as 1 in 3. It is estimated that 30% of postmenopausal women suffer from osteoporosis. And not only this, 1 out of every 3 females and 1 out of every 5 males will have fracture as a result of osteoporosis from the age of 50. Women generally have low level of vitamin D, and furthermore, it is observed that more than 50% loss of bone strength during menopausal period occur among women of African descent. Number 2 reason why I'm bringing this topic your way today is that of the aging population. It has been predicted that worldwide, the number of hip fractures will increase drastically to 6.3 million per year by the year 2050 due to increased longevity alone. And Africans are not left behind in the area of aging population. In essence, Africans are among this aging population. They have people that are aging. So they need to bring this topic your way. Furthermore, within this aging population reason, 50% of women in Australia, for example, between ages 60 and 64 years have osteoporosis. This value tends to increase to as high as 71% by the time people get to age 80 and above. Number 3 reason for bringing this topic your way is that of global estimates. Global estimate tells us that by the year 2050, the number of people with osteoporosis globally will reach 6 million, and about 3/4 of these will be from developing countries. A majority of these developing countries are in African continent. The morbidity and mortality rates that occur or associated with osteoporosis is another reason. Yes, osteoporosis may not be as common in Blacks or Africans, but there is higher mortality and morbidity rate that is associated when it occurs. If then this is the case, what do you suggest are the risk factors? Number one, from what we have said before, you may be able to deduce that increasing age is a risk factor. Osteoporosis is associated with age. Genetical reason is another risk factor in terms of race, ethnicity, and heredity. Though osteoporosis is worldwide, its effect is mainly dependent on race and ethnicity. Environmental factor is another risk factor, like the case of nutrition, especially calcium or vitamin D deficiency, lack of physical activity or exercise, poor exposure to sunlight, long usage of drugs like steroids, thiazides, falls, or other trauma are environmental factors that create risk factor for osteoporosis. Furthermore, many diseases and their treatments are also predisposing factors. For example, in the case of rheumatoid arthritis, sickle cell anemia, multiple myeloma, diabetes mellitus, and breast cancer, their treatment regime presents risk for osteoporosis. The parts of the body that are most susceptible to osteoporosis are the spine, the neck of femur, and the wrist. You may then be wondering, how can it be managed? Osteoporosis, management of osteoporosis increasingly is tending towards the need for formal and informal education. There is a growing emphasis on raising awareness with the argument that prevalence rates will likely reduce with more awareness. Thus, formal and informal education programs are important to ensure disease-related knowledge to all and sundry, and to ultimately prevent fractures. And in fact, education programs have been shown to be effective in reducing the risk factors of osteoporosis. So this is where we're going to start. This is where we're going to stop for today. This is where we're going to stop for today. I would like to thank you for being part of our weekly program. And in case you are wondering who you are speaking to, or you are listening to, or who you are watching, this is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Until when I come your way again next week, I'd like to thank you for being there. Please keep on lookout for the health of your bones, and let's see how we all together reduce the prevalence of osteoporosis in our community. Until then, it's bye for now. Thank you.